first in the world to develop this procedure. It's called the frozen shoulder dissection procedure. And I have successfully restored ranges of motion to numerous frozen shoulders, probably 100 over the past 4 years. We will be publishing a paper on it. And one of the things that I've found is that in probably 90% of the cases there's some type of disc lesion at C5, 6. That's the nerve root level where the nerves are that go into the shoulder girdle, the muscles of the shoulder girdle, supplying those muscles with the necessary information to function properly. And if the nerve supply to those muscles is not correct, the muscles will not behave properly, they'll not be able to pull properly, they won't have as much strength against force, and if force is applied against those muscles, where they would normally be able to accept the force with the nerve interference created by the disc lesion, which is often seen on X-ray as degenerative disc disease, and then you see it on the MRI as a disc lesion. That interference will lead to susceptibility of injury of the musculature that can't handle the stress, or of the tendons, usually of the tendons. It may cause a tearing, it may also just cause an inflammatory condition, which in turn can precipitate carrying an effusion of inflammation throughout the shoulder girdle into the capsule and into those areas, into what we call the bursa, which in turn cause some degree of adhesing or adhesions to develop, where the bursa or the capsule begins to sort of stick together. And then the frozen shoulder develops. So I'm looking at the x-rays here of the patient that we're just about to treat, and I can see clearly 1, 2, 3, 4, 5, 6 that at C5, 6 he definitely has a problem. And so and he also has a complete reversal of the normal neck curvature at this point. So if we were to take an MRI, we will probably find some type of a disc lesion, disc herniation, disc bulge with some compression of the nerves that go into the shoulder, making it more susceptible to what we refer to as a frozen shoulder. So we're about to begin the procedure. I'm going to start in the next few minutes. The patient has just gone to see their medical doctor. The doctor has, or the doctor that we work with actually at this clinic, he's put injections into the front and the back of the shoulder into the capsule with some anesthetic, so that the patient doesn't feel as much discomfort or pain during the procedure, because otherwise without anesthetic it can be very painful. We do perform the procedures without anesthetic, or we perform them with anesthetic, depending upon the patient's preference. Sometimes the anesthetic can also be just given orally rather than with a needle, and that's up again to the patient and to their, it's entirely up to them. So that's basically it, and we're going to get started with the Trigenics frozen shoulder procedure. You'll not be coming in on the actual procedure, but we are going to do the good shoulder first, straight up sideways. Straight up all the way up? All the way up as high as you can go. Don't turn the hand, keep it this way. Keep it which way? Yeah, keep it just like that, yeah. Yeah, okay. That's about as high as that one goes, okay. Okay. Now keep that one up. Keep that one up. Let's see the other one now. Okay. No, keep the other one up. Keep that one up. Oh, yeah. Sorry, it's hard to coordinate. Just two out of beds. Okay. 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 Well, that's as far as that goes. Yeah, we're stopping there, it seems. Okay. I'm about to do the procedure here now. If I actually hold it down, just relax. I'm just lifting it myself. Okay. I'm lifting it myself. Okay. That's about the end point there. Yeah. If I hold this one down. That's a different endpoint. Okay, so you've got okay. We'll deal with this. So this is my good shoulder. Mm-hmm. Okay. That's the good shoulder. And here's the one that the Dr. Austin just worked on. That shoulder that you saw. You saw the before it was locked just in here, right? I couldn't. And I wouldn't have had the.
Lift them both together again.
Oh, okay. Well, anyway, it's a heck of a lot better, right? Yeah. She's on and doing. So we're going to see the shoulder that's the good shoulder. Let's go. We just finished doing the procedure, and now we're going to see the shoulder we just did the procedure on. Beautiful. And now both of them together.
So what do you say?
Oh,
that's good.
That's
wow,
nice.
You wouldn't be able to do that on a frozen shoulder.
No.
When was the last time you did a push-up?
Oh, a long time ago, man. 12 months.
Just finished the procedure. And we have a fairly happy patient here. He's able to move his arm, and he's going to get his life back, right?
Yeah,
so let's raise that arm up. Let's see it. Here we go. And all the way up. frozen shoulder. Adhesive capsulitis affects 4 to 5% of the population, and it's growing in numbers. The number of people getting frozen shoulder worldwide is increasing significantly for some reason. Nobody's sure why, but every year there seems to be more and more cases of frozen shoulder. In terms of how this has affected your life, Lisa, what are the things that you can't do anymore?
I've not been very good at washing my hair.
How would you wash your hair? Show me how you try.
Literally with my head back.
And the other hand?
The other hand's absolutely fine.
That's as far as that one goes.
But this one is just horrendous.
Yeah. Okay, all right.
Eating is proven a problem because I'm left-handed. So I can eat for a little while and then I literally have to drop.
Trying to put your bra on, is that hard?
Oh, horrendous.
Let me see you trying to put your bra on. Turn around, let me see if you try to put it on behind your back. Go ahead, turn around.
I can't. I literally can't. I can't do anything. I can't get it off.
Okay.
So it's
all right. What about shaving under your arms?
No, I haven't hardly been doing.
There's no way about that one either.
No, it's horrendous. It's like I can't wait to get my arm back.
It's a reaction of the body where the body itself begins to protect the shoulder joint by laying down large amounts of scar tissue or hard tissue around the entire shoulder joint. Really, it should be like this. But now it won't go anywhere. And the condition is excruciatingly painful. It is one of the most painful conditions that exists known to man. They can't put on their shirt, they can't put on their coat, they can't wash their hair, they can't shave their underarms, they can't do anything. It's completely and totally debilitating. At night, they can't sleep. Many of the people that come have not slept for months and sometimes years for a full 8 hours without waking up in excruciating, terrible pain. What we're going to do is we're going to do a procedure that will open the adhesions, the scar tissue inside. We'll open it up. And you are an interactive participant. We're using something called Trigenics. And Trigenics is an interactive neurological muscle or reprogramming system that reprograms the way the nerves are going into the muscles. All these muscles are shut off. Now, when we go to do the procedure, some other muscles will try to contract very hard. And we're going to have you move and press in a certain way that will shut off some of the signals to those muscles. And when those signals get shut off, then I can do the procedure and very quickly your arm will be up.
Vaevatud ent lootusrikas Sandra on lahkelt nõus näitama, kui palju tema haige käsi üldse liikuda saab.
Now, how far can this one go without moving the shoulder? And that's it, huh? Okay. And the interesting thing, if we turn you around, let's turn around. The interesting thing is you can see that already the entire shoulder is moving. It's not, you see here, this point stays the same. You see? But here, look, my finger, see? My finger is going already up. Inside is completely frozen. That's why her whole shoulder is moving. Try to move it up again.
Dr. Oolo valmistab Sandra eelseisvaks protseduuriks ette kaela ja õla täristamisega. Tegelikult on sellel aparaadil vägagi tähtis roll.
This is just an instrument that we developed for performing the Trigenics procedures that stimulates the nerve sensors while the person is doing resisted exercise, which is also, I know that one hurts, I'm sorry, breathe, and down, I know it hurts.
Sandra saab tuimestava süsti, mille toime saabub 10 minutiga. Seni kuulame Dr. Oolo kirjeldust oma protseduurile.
With my treatment, we do local anesthetic injections, and then we have a specific way where I use this treatment called Trigenics. I use a neurological method of shutting down the muscles that go into contracture when we hit the pain. When we hit the level of pain, I use a way where I involve the patient where he is actually working with me and he's moving against heavy resistance in a way that I cause a shutdown of the nerve signals going to the muscle that would otherwise not allow me to open the joint. And then when those muscles shut down, then I can open the joint and I can separate the scar tissue internally without using a knife from outside.
Sandral palutakse protseduuri jaoks pikali heita, aga meie tutvustame teile seni teist patsienti. Tema nimi on Jüri ja Jüri ei ole saanud 4 kuud külmunud õla tõttu oma kätt liigutada. Jürigi saab kõigepealt tuimestava süsti. Nüüd aga siirdume taas Sandra juurde, et vaadata protseduuri tulemusi.
Very, very good. You can keep it up by yourself. A lot of people can't do that. So you're actually better than a lot of people now because you have that strength in your muscles. Can you bring it down very slowly? Be careful. Don't let it drop suddenly. Be very careful. Very careful. Very careful. Very careful. Very careful. Very careful. It's only your first time. Within the next hour, we're going to have you bringing it up by yourself and down, but that's just the beginning. We just finished the OAT procedure for adhesive capsulitis, frozen shoulder, which 4% of the world's population suffers from. And with this particular lady that flew from Norway to Estonia, with her adhesive capsulitis, she was basically what I refer to as a grade 10. She had the worst possible scar tissue formation and adhesions that had formed in the capsule. There was basically no motion of the shoulder. All of the procedures that I've done over the last 10 years, not a single one of them has ever come back to have done a second procedure, and none of them have had a reoccurrence of the frozen shoulder. So the prognosis is good, even though on the first day it doesn't look that great. The prognosis is very good.
Give my life back.
Yeah.
I'm a grown man crying tears of joy. Tears of joy. Tears of joy. I'm a grown man crying tears of joy. I'm a grown man crying tears of joy. Amazing. I can do it.
You can do it. You can do it.
Amazing.
Amazing. You can do it. 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 Yes.
I can do it.
What's going to happen now is he's going to improve every single hour that he does these. He's going to improve. You're going to sit here again facing. Yep, we can use this one. And what I'm going to do now is I'm going to bring the shoulder up. Okay. And what you're going to do is breathe in for me. Breathe in. Breathe out and come down. Come down. Now what I'm doing now is I'm actually stimulating the nerves in the muscle that he didn't use for quite a few months.
Hetkel on see hea tunne, et mu õlg, mis ei liikunud 4 kuud, ma suudan ta üles tõsta. Kujutad ette, ma ei saanud seda 4 kuud teha ja ma saan ka niimoodi teha. Ehkki ta on veel natukene valus praegu, aga see on ikkagi see tunne, et su elukvaliteet on teine. Ma saan tööd teha 2 käega, nii nagu teha. Ja kuna ma olen seda abi otsinud ju päris kõik see aeg, kui see õlg nii-öelda ära külmus, siis täiesti juhuslikult, et see oli üks ja ainus variant, kiireim variant, kuidas seda õlga korda saada. Mina soovitan küll kõigile valida selle kiirema tee, sest et tervis on üks ja ainus siin elus, et kõik ülejäänud on tulev ja minev.
Jüri protseduurist on möödunud nädal. Mees on hoolega võimelnud ja valmis nüüd meilegi tulemusi ette näitama.
Käsi on liikuma hakanud, ehk siis liiges on tõepoolest lahti. Õlg on korras, jah, et selles mõttes oli see protseduur küll õige. Ma saan paremini ennast riidesse, saan püksid paremini jalga, saan jope paremini selga, ühesõnaga normaalset elu elada ja tööd teha.
Look at you. That's what, a few minutes? Only, that's like, well, it's within the last hour we did this, right? Let's see you wash your hair.
Wash my hair, it was absolutely fine and dandy. No problem whatsoever.
Wow.
So I'm absolutely over the moon.
Norrast saatis meile koduvideo õnnelik Sandra, kes nüüd suudab oma kätt just nii palju liigutada, nagu te isegi näete.
And what did the other doctor here in Norway told you?
The doctor in Norway told me that I have to wait 3 years and operations to heal my arm.
First try to fix your arm. Would take 3 years. If it didn't work out in 3 years, you have to make a surgery.
Surgery, yes. And nobody in Norway can help me. Just thanks to God I find Dr. Oolo. And he helped me just in one
treatment.
One day. One day I can do this.
Jüril kipub juba ununema, kui hull lugu täpselt tema käega enne protseduuri algust oli.
No kui ma selle asjaga arsti juurde läksin, siis ma arvan, et ma sain teda umbes nii kõrgele tõsta. Ja samamoodi oli see liikuvus ette ja taha oli piiratud, kuidagi niimoodi. Nüüd, nagu sa näed, läheb see täiesti üles, see tähendab, et see on lahti ja ta liigub ka ilusasti siit ette.
Well, you watched the video, and I just want to say one thing. Someone asked me the other day, what gives you the greatest joy in your practice? And it didn't take me more than a second or a split second to know what that was. And I said to him, the thing that gives me the greatest joy is seeing the incredible smile, beaming smile and joy, and tears of joy often, on the faces of the people that I help, especially the faces of the people with frozen shoulder, where they've suffered for so long, where no one's been able to help them, where they've tried all kinds of therapies that don't help or that often actually make it worse. I just really hope that you believe, your eyes, that you believe in what you've seen here today, because the patients that you've seen are not actors, they're real people. They're just like you, and when you're ready to receive help, I'm ready to help you.
Knowing that now I'm going to go out and live my life and put my shirt on, play with my kids, and that's tears of joy.